this case was one of the most challenging cases of my career. Baby of Sumalata was referred to us from Anantapur. What is special about this baby? The baby was born in RDT hospital in Anantapur, and the reason for delivering this baby was because they thought the baby's heart was racing very high. And when the baby was delivered, they also noticed that the heart rate of the baby was around 250 to 280, because if your heart is beating that fast for a longer period of time, then your heart tends to fail. So this baby was referred to Hridaya Hospital in Anantapur from RDT Hospital for a better care. And there they tried to give a dose of adenosine. This is a lifesaver drug and a drug of choice to treat babies who've got very high heart rate, especially a condition which is called SVT, which is supraventricular tachycardia.
Usually SVT in newborns are very rare. It's a very rare. Congenital SVT is very rare. We get it SVT, but some electrolyte imbalances and some conduction defects or some sepsis can cause SVT. But even that is very rare. I think I have seen 2-3 cases of SVT in newborns. Okay, pediatric we see some cases. And the line of treatment is adenosine, and which is given at RDT that come to the hospital for the further treatment.
So after giving the drug, usually the heart rate will come back to normal. However, it did not happen in our baby's case.
But the heart rate is already too high, and already injection adenosine was given. So the next line of treatment is very complicated. That needs some cardiac monitoring and cardiologist opinions and all this, which is not possible at Anantapur. So we shifted the child to Motherhood Hospital.
Our ambulance set off within 15 to 20 minutes after receiving the phone call. The baby was met at Chikbalapur, which is almost like halfway through from Bangalore to Anantapur. And instead of just bringing the baby to the hospital straight away, we parked our ambulance in a safe place and then started giving.
How is it treated over here? Yeah, it's in the same way. So basically, pediatrics, one is called vagal maneuvers. That means you can put eyes on the children, just on the face. That itself will put the rhythm back. Sometimes we have tried dipping the face of the child in the ice cold water. That itself will bring the rhythm back. That is the first one, which is called the vagal maneuvers. Second one is what the medication that I suggested. Adenosine is still the drug of choice even in the pediatric age group. And adhikinta jasti hogta idre, then you are getting into the realm of beta blockers, amiodarone, flecainide. The reason when it goes more than adenosine to treat becomes very difficult, because you have to have the knowledge of the side effects of these drugs.
Back of how this entire science is evolving in the space of treating newborn children in India. As all of you are aware, there are many parameters in the country which is considered for considering the progress or evaluating the progress of a country. While I'm not going to dwell in the economic indicators, the health indicators are something that all of us know are also an important space which brings out the progress of a country. And in all the health indicators, two of the most important ones is maternal mortality and neonatal mortality. Today we are going to talk about how the progress in this particular space in the neonatal mortality area is progressing well and how it's rapidly coming down.
Sorry, at the outset I apologize for my bad throat, and thank you everyone, friends from the media and my colleagues from Motherhood, for sparing the time and effort and being here. To give you a background, like CEO said, across the network pan-India, the number of hospitals that we have, we are supporting a very robust program for recovery and treatment of very sick neonates, newborns. We have very senior, very well qualified neonatologists across the network, which are about 15 number, and we have about 200 dedicated nurses trained only towards recovery and treatment of very sick newborn children.
And then started treating there itself. So video call ala bandirodrinda, it's much easier. So we look at the rhythm, our doctors are there, our nurse will go with the ambulance. Baby nodkondu rhythm nodi, then yes, this is a correct rhythm, let us give adenosine. We gave 1 dose, we gave 2 doses, we gave 3 doses, it is not reverting back to normal. So then what happens? Okay, is this a diagnosis, correct diagnosis, or are we dealing with something very severe now? So we had to bring the baby back to the unit after trying for 3 times. Unit al band mele enayitu, we started again treating with adenosine. Actually, we have involved the cardiologists, we have involved the cardiothoracic surgeons. Very high heart rate of about 250 to 280 per minute. Normally, a newborn babies would have a heart rate of around 120 to 160. So this heart rate being so high is called supraventricular tachycardia, SVT in short. So babies, when their heart rate is going so high for a long period of time, they can have heart failure, and then the heart will fail to pump the blood, and then a lot of these babies can die. The treatment for this is medical treatment. You are giving medications called adenosine. In some cases, if it is not treatable with that, you keep giving more medications, for example, amiodarone, beta blockers, flecainide. So there are a lot of other medications that can be given. In our case specifically, what happened, the baby did not respond to any of the medical treatment. So we waited for a little bit longer for the medicines to work, only because the baby's heart was good and functioning well. By second day onwards, we started noticing the heart was actually failing. The ventricular contractions were becoming weaker. So this is a time where we have to step in and then give what is called as a shock treatment for the baby. So we administered 3 doses of shock treatment, and in spite of that, the baby's heart did not come back to normal. So when we give a shock therapy, usually the heart will stop for a fraction of a second and it will restart. It is like booting the computer basically. So when the heart restarts, generally it will go back to normal rhythm. So in this case, it did not go back to normal rhythm. So this is when there is a baby where you have tried a lot of medical treatment, you've tried giving shock to the baby, and heart is not functioning well. This is when we had to go out of the box and then think about a novel therapy which can be used in order to save the baby. So this is when we administered a therapy called total body cooling, where the baby's temperature is brought down to about 33.5 degrees in order to make sure that the heart rate comes down. So by God's grace, it did happen. 4 to 6 hours after starting the treatment, the heart rate started getting better and all the rhythm came back to normal rhythm. And we had to maintain this for some more time and make sure that the heart goes back to normal function. Then we started rewarming this baby very, very slowly, because if you're starting to rewarm, sometimes the rhythm will come back to the SVT. So luckily that did not happen. And then once we stopped the therapy, the baby's heart was functioning normally and it had a normal heart rate of about 130 to 140, and then the rhythm of the heart was also normal. And then the baby was maintained on 3 medications for a period of about 1 month, sent back to where it came back from, and had a connection with the doctors there, continued the medical treatment in Anantapur, that's where the baby came from, and then made sure after 1 month we stopped all the medications. So we reviewed the baby after about 6 weeks, we repeated the ultrasound scan of the heart, and we were very, very happy to say that the heart was functioning normally and then the rhythm was also normal. And this baby girl was a bundle of joy to actually look at.